Hello, my name is Dr. Diwan S. Raja. Today I discuss about artificial pacemaker and its related anatomy. So, we need artificial cardiac pacemaker when our natural pacemaker is not working. We have natural pacemaker, that is the SA node. That SA node should be present on the roof of the right atrium at the junction between the superior vena cava and the right atrium. Okay, so that is the natural pacemaker. Okay, so pacemaker is the SA node, sinoatrial node. Okay, is the SA node or sinoatrial node. SA node is located in the roof of the right atrium at the junction of right atrium and the superior vena cava Okay, so that is our natural pacemaker, the SA node. Sometimes this SA node may not work. Okay, so we need artificial cardiac pacemaker. Okay, we may have some, so we must know the indications of pacemaker. Indications of artificial cardiac pacemaker. Okay, pacemaker placement. Okay, so what are the indications? One is the non-functioning of the SA node due to any reason. Non-functioning of the SA node, sinoatrial node. Okay, due to heart block. Okay, we know that the impulse goes from SA node to AV node, bundle of his, then right and left branch of the AV bundle, then it should go through the Purkinje fiber to the muscles of the left ventricle and right ventricle. Okay, so if there is any heart block or in atrial fibrillation, and also in heart failure. Okay, there are many reasons for the placement of the artificial cardiac pacemaker. Okay, these are the indications. So what are the types of pacemaker? It may be mono chamber. Okay, types of pacemaker. Certainly artificial pacemakers. Okay, these are the mono chamber pacemaker. It may be bi-chamber, or you can say two-chamber pacemaker. pacemaker. Okay. Or it may be biventricular pacemaker. Biventricular pacemaker. Okay, these are way. So types of pacemaker. This is placed in the right atrium. Only right atrium. This is placed in the right atrium. The lead will be in the right atrium. The wire. This will be usually right atrium plus right ventricle, right atrium and right ventricle. Okay, biventricular placed in left ventricle and right ventricle and right ventricle, right ventricle. Okay, we got that. Pacemaker. So what are the components of a pacemaker? Pacemaker component, we need the something like a battery. Okay, and the cord should come from there and it should be placed in the heart wall. Okay, inside the heart wall. So this is the generator. It works by a battery. Okay, these are the leads or where. Okay, it should be. So how the pacemaker is introduced in our body. Okay, so where it is placed, this battery is placed usually just in the subcutaneously. It is placed subcutaneously below the clavicle, over the pectoralis major muscle. Okay, that is the way. So there is an incision is made, skin is removed, there is a pocket is produced. In the pocket, the surgeon place this generator. Okay, this is the generator for impulse. This is the lead or where. I can say lead. Okay, we got that. So it should be just under the clavicle, but in some emergency, it may be in the cubital fossa, emergency situation. Okay, we got that. The location. Now we have to know something. First of all, one chamber or monochamber, one chamber pacemaker. How we can go there? Okay, so we can go through our cephalic vein, the axillary vein, subclavian vein, then we'll go to the brachiocephalic vein, superior vena cava. Okay, I can write it here. So we can go through the, if we go through a cephalic vein, axillary vein, then subclavian vein, then brachiocephalic vein, okay, then we'll go to the superior vena cava, then we'll go to the right atrium, okay, so that is the way. So this is the right brachiocephalic vein. So suppose you like to go through the left side. Okay, this is the left brachiocephalic vein. The brachiocephalic vein is formed by the union of the left internal jugular vein, left subclavian vein. So some surgeon prefer to go to the subclavian vein directly, okay, or someone may follow the cephalic vein, axillary vein to subclavian vein, then from subclavian vein to the brachiocephalic vein, brachiocephalic vein to the superior vena cava, then we can go to the right atrium. From right atrium, okay, if it is monochamber pacemaker, then it is placed in the right atrium, okay. This is one way. If it is two-chamber pacemaker, okay, then one of the lead will be here, another lead should go through the tricuspid valve here to the right atrium, then the wire will be fixed to the trabeculae carni of the right ventricle, okay. So from right atrium to right ventricle to the tricuspid valve, then the wire should be fixed to the trabeculae carni in the wall of the right ventricle. So that is the way for the two chambers. So from right atrium, and we should go to the tricuspid valve, okay, tricuspid valve. One probe will be in the right atrium, another probe will go to the right ventricle, tricuspid valve, it will go to the right ventricle, then it is fixed to the trabeculae carni, the irregular muscle in the wall of the right ventricle, carni. Okay, so we can go that way in two-chamber pacemaker, okay. So it may go to the right ventricle or both right ventricle or right atrium. Now we go to the biventricular pacemaker. So we must go to the right ventricle, as I mentioned, the brachiocephalic vein, superior vena cava, right atrium, tricuspid valve, so right ventricle. One, how can I go to the left ventricle? Okay, so for the left ventricle, we can go through from the right atrium, okay, to the left ventricle. How can I go there? From right atrium then through the coronary sinus, then to the left ventricle. Okay, what is the coronary sinus? So this is the right atrium, this is the coronary sinus. Coronary sinus is the vein between the left atrium, left ventricle. So where is passed, we know that the coronary sinus opens into the right atrium, coronary sinus. We can easily go through that. Then through the coronary sinus we can pass our probe and it should go to the left ventricle. Then you can penetrate the left ventricle. This all should be done under fluoroscope, okay, through the fluoroscopy, so that it should guide us, and catheter. We need catheter and fluoroscopy to put the wire in the exact position. So we have learned the indications, we have learned the natural pacemaker, the indications for placement of artificial pacemaker, different type of pacemaker, how we can go to the right atrium, right ventricle and left ventricle. Especially for the left ventricle, we must go through the coronary sinus from right atrium, then through the opening of the coronary sinus to the coronary sinus that should go posteriorly here, and it should penetrate the left ventricle. Okay, so that's all about the anatomy of the artificial pacemaker placement. If you have any question, please let me know and please ask me. Share the information with your friends and please subscribe my channel. Please support my channel. Have a nice day. Bye.